Hello, friends. Welcome to this special podcast on the 35th anniversary of Mamta Health Institute for Mother and Child, or Mamta, as it is widely known. It has been an incredible journey for this organization for last 35 years, interspersed with challenges, learnings, and achievements. Today, we have with us the person whose vision and whose toil has created this wonderful institution, Dr. Sunil Mehra, the founder and the executive director of the Mamta Health Institute for Mother and Child. So, it's a privilege to be associated with Mamta for so many years. We both colleagues have not only grown with this organization, but have also witnessed the organization growing in the last 10 to 15 years. Many young people in the organization, as well as our stakeholders in this sector, beyond the sector, they are very curious about Mamta and its growth story. And so we decided who could better explain this and throw light on this incredible journey. Sir, how this journey began?
I still remember 1990s when I went to an urban slum called Tigri in Delhi for some function. And while passing through a slum, I did feel something about because I almost traveled throughout the slum till its other end and saw lots of children, mothers around bathing in the sun. It was winter season. They looked impoverished, undernourished, and were not in the best of the health that you could ever think of, or the best looking in terms of their health. So, before this, I must say there must have been a seed in me which would have triggered off my thought process while going through the slum. While doing my post graduation in medicine, I went to Ghazipur, a district next to Varanasi, where I went for my postgraduate thesis. I think some of the memories of that, and plus, I think inherently, I always felt while working in BHU hospital, is the poorest who were really not getting the best of the care and treatment. So I think it was a culmination of all this thought process of working for uh, the underprivileged or marginalized. And I felt we need to do something beyond what we were doing, what I was doing as an individual, because I was into a significantly well placed practice, which was in the clinical pediatrics. And I've been doing reasonably well working with the well offs of the society and doing really good job in that sector also in that clinical practice of mine. So this travel and this journey through the slum actually triggered our thought processes and made me think that let's do something about them. And one fine day, I decided to pick up my car. I had a colleague who was also a pediatrician. In fact, we both decided, can we do something in the Tigri slum? And we went on to the slum with a box of medicines in our boot of the car and started doing a outdoor clinic in slum to provide some kind of good quality care and practice and clinical practice for them. This went on for some time, but then one realized that just giving medicine, curing a particular bout of illness was not enough for health outcomes to be seen. One started reading more about public health also, other than the clinical care. And one realized that it was overall health which was more critical than just managing a particular episode. And to do that, people advised and everybody said, let's establish an institution. And we thought of putting together a not for profit organization called Mamta. And Mamta, by its name, meant mother's love for the child. As a pediatrician, it was always a passion to work for mother and children. So the journey began at that point of time in Tigri, in urban poor setting, in an urban slum, which was surrounded by one of the most filthy surroundings you could think of.
Right. In fact, we always used to wonder. I mean, early 90s, you were a successful pediatrician and coming into this social service sector. It has to be a very good heart and, the intent, that strong commitment to work for the community. Uh, but looking back, was it, I mean, it won't be that easy. There must be some early challenges of establishing an institution or a social enterprise like Mamta.
Establishing an institution is always a challenge. There's no doubt about it. And I don't think I would say it was anything different. Yes, registering the organization, getting the board in place, getting its aims and objectives well articulated, creating a financial system, and then registering yourself as you, at that time it was called 12A and ATG, under the not-for-profit organizations, and then went on to get the FCRA. The interesting thing is that being, as I said, in clinical practice, I had some kind of linkages and connected with people in development sector. So Swedish government, SIDA at that time, what was called, I approached them that I want to do this work for maternal and newborn child health. Can you help us? And I think the interesting thing was that SIDA uh, did agree to support Mamta, but the interesting thing was we did not have the FCRA, what called the Foreign Contribution Regulation Act permission. So we had to get the FCRA done, and FCRA was given to us within I think 2 years of our existence. That really started the journey of getting funding from institutions. Look, funding is important. Howsoever passionate you might be, howsoever idealistic thoughts you might have, but you need to deliver through a workforce. And to get that workforce, you needed some funding. Interestingly, at that time, to address some of the funding challenges, some of the staff who came with us from that very slum were so dedicated, were so committed to the purpose that we were on to improve the health of maternal, newborn, and child health, that we made certain bed sheets, we made certain candles, and we sold all of that in the slum itself. And then we took a small office outside near that slum called Saket area, where we established a small office. And the staff used to make all the stuff which used to be sold in my clinic at a very, very reasonable, or very, very high price, because they could pay it. And they all knew that they were not buying just a sheet, they were contributing to the health and wellness of people in poverty or in kind of a context where they wanted to put that investment of their or money of theirs so that their health improved. So we complemented the funding with our own efforts of self generation of the funds which came together. And why I'm saying all this, these were all small efforts which, if I look after 35 years later, they look so wonderful and they look so nice that there was a team of bunch of people, not just me, but these bunch of people who came together to put this effort into a shape so that this could be taken further. So these were initial challenges: establishing yourself, financial system, administrative structure, legal compliances, and then getting the funding, getting some people who could come together and believe in you and believe in your cause, and then the journey actually began and started. After that, I would say it was a journey that moved on, and probably we can go later how that journey then unfolded in these 35 years. But that was the beginning and starting point. So challenges were initially.
Right. So, just a little bit about what was the socio-political landscape during those days, especially the health context, which actually shaped Mamta's priorities in those years.
You know, interestingly, poverty was a big issue at that time, mind you, right? Although we have improved so much in 35 years, but at that time, poverty was a big area of concern. The the dwellings or the ecosystem under which people existed were also quite a bit of challenges. If you look at epidemiology, or if you look at NFHS 2 or 3 at that time, there were issues like child marriage, issues of anemia, issues of undernutrition were significant. So we actually, from day one of the organization or the institutional journey, we were very much science based. We were very much based on evidence and epidemiology. The political environment, I wouldn't say was of any challenge. It was very supportive, or there were laws, there were legislation under which we could establish the institution, we could work, and there were norms under which we could get the fundings. So the legal system or the compliance system was reasonably comfortable to work at that time. But the health epidemiology, or the demographic scenarios were very, very challenging, and you had many issues to address from the beginning, especially when it came to. And I think that brought us into a totally new area of adolescent health. I think Mamta can take pride that we were probably one of the few in the country who spoke about this age group of 10 to 19. I kept on saying since that we are missing something in the life course. And this life course was 10 to 19. As a pediatrician, I call it third spurt of life, which was unaddressed under the maternal newborn child health programs of Government of India, or for that matter, even at the global level. Adolescent health was insignificantly addressed as far as the maternal newborn child health. So these were certain health issues or challenges which were very obvious from the epidemiology. Hence, our program was very much oriented toward this.
And I see how Mamta had started working on one of the social determinant of women's health, that is child marriage. And that was something very thought about, group of pediatricians working on such.
That's right.
Dr. Mehra, over the decades, we have seen that organization has worked on several themes, diverse geographies. What had been some of the significant, or I can say major challenges in scaling up the work that Mamta had been doing and also sustaining it?
I think the interesting thing is good work gives good yields, right? And yields can be in various forms. So the commitment and passion was so much, means I think what I brought to Mamta was passion, wise and commitment. That there was a passion, there was a commitment, and as you rightly said, I was coming from a very comfortable economic background, and for me, it was about this. And having this as the backdrop, uh, starting work in urban slum was interesting because urban poverty was beginning to be recognized, because by and large, most of our programs were rural poverty driven. And urban poverty was very different from the rural poverty. And urban determinants of health, in fact, were showing much worse in the NFHS 3. If you were, when we compared, I do recollect that urban poor backdrop of infant mortality, under 5 mortality, maternal mortality was much worse as compared to the rural. But bulk 80% of India at that time was rural. So for us to just confine ourselves to urban population was not the way to go. So somewhere around, I think I would put it around 96, 97, we went rural. And when we started getting rural, the the coverage was huge. You couldn't have done in a such a big manner. And I must mention here, I think there were 2 donors or 3 donors I would like to mention. Firstly, I want to mention about ActionAid UK. I think they taught us significant learning about what is participation, what is community engagement, and how communities are at the center of the development that we do ever. Second was Swedish CEDA. The Swedish CEDA came into, as I said earlier, with the first support to us, which was titled as Integrated Approach to Maternal and Newborn Child Health in Urban Poor, where we brought the adolescent health component as part of the integrated approach. But having done some reasonably good work in terms of the indicators and the health outcome changes, we could manage or get the support of CEDA to work across 7 states in India while focusing on adolescent and young people, while focusing on sexual reproductive health and rights, while focusing on adolescent pregnancy and neonatal and fetal outcomes. So I think I would go all out to say I think it was significant contribution of the Swedish support and CEDA support which made us grow, not just uh, in terms of our geographical reach, but in terms of our institutional capacity building, building our administrative structure, financial structures, strengthening our support. You know, CEDA even supported us to make connectivity and linkage with international universities like London School of Economics, London Schools of Health and Tropical Medicine, with Australian university like a Nozel Institute, like partnership with many Swedish institutions like Karolinska Institute, Uppsala, Lund University. So I think that second support really made us grow and fly very, very quickly in terms of the support. And the third, I would give it to, look, I'm mentioning three, but there are many, but I'm just highlighting these three to just say the third one was the MacArthur Foundation. And the MacArthur Foundation came into partnership in 98, 99, and they helped us in taking up the national contextual issue like child marriage, like working for young and adolescents in almost 30 to 40 districts of India. Whereas CEDA was supporting us, Swedish was supporting us to work somewhere close to 99 to 100 districts. MacArthur even supported us to bring together many policies and norms at district level to do a kind of a comprehensive approach to addressing social determinants of adolescent health. After that, I think the journey goes on, but let me say that these three institutions made our journey kickstart, or for that matter fly rather than crawl, very quickly, with their support from mid 90s, which carried on till almost 2015-16. CEDA supported us till 15-16. I think MacArthur also supported it till that time from 98-99. ActionAid support was shorter, what ended by about 2001-2, but they gave us a tremendous learning about what is community engagement, participation, what we used to call PRA and PLA, participative research appraisal and learning actions. So this was something which I thought was interesting. For scaling up, I think your question was how did we went up? I think these three funds supports helped us.
Right. For an organization, when these support came for, 10 or 12 or 15 years old organization, this is huge. It won't be so simple. How did organization and you as the executive director navigate complexities of working with diverse stakeholders, many from the sector, many beyond the sector, out of the sector, including communities, government systems, and network partners. I know Mamta had a big huge network of NGOs. So how did you manage this?
I think nothing comes through textbooks. Everything comes through learning. And as you grow, as you do, as you mistakes, as you commit mistakes, I think this journey has to be said it's learning by doing, right? And when you're learning by doing, you will bound to commit mistakes. But as long as you make honest mistakes, people accept them. Person across the table sees the honesty in you, then I think you can manage any complexity. To me, the critical side was that we were honest. Means I made this as a value system in the organization, that let's not be dishonest to anyone whom we work with. And I think this really helped institution in managing government partnerships, donor partnerships, international relationships, and on the other side, it's very, very important to be honest to communities that you work with. You need to be very upfront in saying, why are you here? What is in for you and what is in for me when I work with you, right? I still remember the backlash of Tigray when we were talking about sexuality. But you had to sit with the community and explain why sexuality was important in context of the reproductive health, in context of the HIV, in context of as the adolescents grow and they become young individuals, sexuality plays a significant role in their well-being, in their health and well-being. So I think I would just use one word: be honest. So I think that modesty and honesty both were critical. And I think why you see donors supporting us for so long, many of them 15, 18, 20 years. In fact, they might have carried on if the government of India's policy was not there in 2012, 13, that we do not want some donors in India. So most of them had to wrap up in 2, 3 years. So I think the funding had to stop from them. If they had existed, my sense is that they would have carried on. But important thing was they could continue for so long was because of what I said earlier. We were true. We did everything to our best to achieve the results that we had promised. But if we could not, we were equally honest enough in saying, sorry, this did not happen. And this leads you to the kind of managing the stake. And same is true for the governments, same is true for the communities. And when you're straightforward, you're there to say what your interests are. Why is it important for the communities to do what you're doing with them? And state is there always to help you.
Right. Right. So I see this whole, honesty reflected in Mamta's vision statement, very well crafted vision statement the organization has. So, was there any time when this vision of Mamta was tested, and how, in that situation, Mamta, was resilient, you know, if there was any challenge to our vision statement?
I think the vision and mission statement was made with a purpose. I don't see, honestly, a challenge to the vision of the, but to stay committed to the vision that we have put for ourselves is something a challenge for the institution rather than for the outside world. Means for now we are about 750, 800, sometimes more staff. And to see that each one of us adhering to the vision of the institution is a challenge, I would put it that way. But I wouldn't say we got any challenge from the external world. External world was not a challenge. I think it was within the institution to see when, and I think you can see this challenge would be getting more and more when we move from conventional development donors to CSR fundings, right, to corporate social responsibility fundings, which started around 2013-14. And I think when you move to CSR, it's for the institution to see that your vision doesn't get diluted for the sake of funding. It may be a challenge, but that is something which we ought to see, that we do not give up or do not dilute the vision. And it was established somewhere in 2000, 2002, the vision mission, and it's 2025, 26. I don't think we have felt the need to change this vision or mission. I think we are moving in each of our strategic plans. I think we have adhered to this vision and commission of the organization.
Yeah. No, very well said.
Dr. Mehra, some of us entered Mamta when Mamta was rising star in from a small degree initiative to a national institution. And now we see that Mamta has a presence in about 26 states in India. So what can you tell us a few approaches that are working with for Mamta to make it future ready?
I think we were very, I used to say this one word: we are a learning institution. I've said this in few meetings, that we are a learning institution. Learn from what we did in adolescent development centers in Tigri, where a small space was taken to bring young girls out of their houses into a space where their identity was recognized. They started having aspirations. And we never gave up on that learning, mind you, right? We kept on working with the adolescents with the pretext or context that we learned in Tigri, which was 94, 95, 96. And that learning has carried on. If you look at the international literature, safe space concept came, youth information centers came. That grew into a kind of a national space where people could do things. And we very smartly and strategically did two things to take this agenda forward. I'm just taking this specific example to answer your question. We entered into a partnership with the Sweden institution called RFSU and with the ministry here to put in an ITP program, International Training Program. That program brought us in the canvas of 10 countries in South and Southeast Asia. And that became a very important milestone in Mamta's journey to not just be a national institution, but be an international entity also to address the sexual reproductive health and rights of young people. But we didn't stop there, mind you. We moved on to doing what we call national training program on similarly sexual reproductive health and rights in partnership with the ministry, the NIHFW, National Institute of Health and Family Care, and a Swedish university called Lund University. That brought in together government representative, only public healthcare representatives from more than 18, 19 states, right? 25 participants in each batch means 125 in 5 years. And why I say this, this allowed you to work with the key constituencies of public sector in Northeast, in South, in East, in West, in North. So it helped Mamta's entry and penetration and footprints in so many states way back 2010, 11, 12, right? And this made from a small Tigri slum to working in UP, Rajasthan, Haryana, to across the country kind of an establishment where people recognized Mamta as an institution which could deliver on some of the front. Look, when I'm talking about young sexual reproductive health and rights, I'm talking about adolescent marriages, I'm talking about adolescent pregnancies, fetal outcome, I'm talking about sexuality, I'm talking about HIV, I'm talking about health systems and strengthening health system to address. I used to say health systems could respond to 6 years, 16 years, and 26 years has to be different. You can't treat 16-year like either 6 or 26. Hence, strengthening health systems across was central to many of this kind of training programs that we did. And what it also did was it allowed us to bring international expertise into these trainings. From London School, as I said, from Australia, from US, from many universities, expertise were invited to talk to these participants as we went on. So I think there was a kind of a very sequential progress made from community interventions to making interventions. Because look, adolescent and young people agenda was primitive at that time. To make it have an impact, you had to do something very scaled up level for it to be. Like I think in the earlier conversation, Priyanka was saying that we had networks. We had networks of almost 137 institutions from across 7 states who learned the fundamentals of sexual reproductive health and rights of young people, which meant that they became the seeds in their respective states to support working with states on different aspects of work that I've been talking about. So making it national was not a one-time process. It was a continuum which kept on organically growing further and further and hence helped institution to work across many states, right? And now we have, I'm sure you know, we have 7 state offices which address many states across their uh, focal state that they are in, and hence it allows them to work at national level.
So what we are hearing from you is that the journey has not been very scripted. It's come out of science, it's come out of learning, it's come out of your own experience. Can you, and what we are hearing also is that we became from a very nascent institution to a national, to a regional, and then a global, I would say. Uh, can you give us one or two or three achievements, maybe, about what you think how the institution has been put on the global map? What have been the three achievements through which you can say that we have reached the global map?
That's interesting, dear. One of the things that has allowed us to be at the global lab is my work with WHO, or the institutional work with WHO. I've been part of the many technical steering committees of WHO headquarters in Geneva, and some of them in the regional office here in the CIRO. Why I say this, when you were part of these groups, they were represented by international institutions also. You were not just alone. People like Bob Bloom, right? People like George Patton, David Ross, Bloom, who were all pioneers in the work at global level. You had an opportunity to work with most of them. Chandramouli kind of people, Jane Ferguson, Bruce Dix, they were all global experts. So you had an opportunity to talk to most of them and interact with them. And that allowed, and you were sharing what Mamta was doing, that allowed Mamta to have its international presence as well. Besides that, I gave a talk in United Nations General Assembly special session in early 2000 that again allowed us to talk to the heads of the state as early as 2002, 2000. Yeah, it was around 2002, to talk about child marriage issue and child marriage agenda. Then again, the global presence came when we won that Safe Motherhood a global award, which allowed, and one of the attributes of that award was to do advocacy with senates and congressmen on the issues of Southeast Asia. So these kinds of opportunities, and many of the Mamta staff and colleagues were frequently visiting USK universities or Swedish universities to get an international exposure in terms of their knowledge, in terms of their academia, which allowed the global presence to be further penetrated through professional exchange between Mamta staff and external. You yourself would know that your work with Cambodia and Indonesia allowed you to work with the institutions in those countries. And above all, I must say, from 2007-8, we have been continuously working with Bangladesh, Nepal, and very recently with Afghanistan through the WHO support on various issues around the institutional competency and center. So the global footprint, even we went up to the extent, you would recollect, to Burundi, where in the Africa, where we supported and strengthened the networks on the HIV networks. So I think it was just again a kind of I would say WHO is very central to it. Then the second one I forgot to mention was Frontline AIDS. I think Frontline AIDS and HIV/AIDS Alliance Partnership allowed us to work with a lot of African countries, especially around the issues of sexual reproductive health rights and HIV. So I think that should also be taken into account when you ask this question, how did we become a global entity? I think these, to be, again, if I was to summarize in one sentence, learn globally, act locally. So we followed that principle. We tried to learn a lot from the global platforms, but we brought it back to the institution. And institution forte was implementation. We always took pride in that. Okay.
So, one question which a lot of us in the institution we want to hear from you is, what is your cherished big moment, you as a leader? It's a little personal question, but it goes when we say how the institution has been achieving so much, going regional, national, global. You as a leader, what has been your big moment that you cherish?
I think it's get difficult. There were so many moments in this journey of 35 years which I can cherish. Like I said, talking in UNGAS, at a National General Assembly session, or giving a brief advocacy talk in White House, Chapel Hill. There are many movements that happened, right? Then having spoken in Swedish Parliament, there are many movements. But I think as an institution, I feel, or even personally, I feel that one country or one donor which I feel strengthened the institution the most was the Swedish SIDA. And I always felt they brought the value, they brought the rights issues into us, they brought the sexual reproductive health and rights as a forte with us, and we continue to work with them. So the day I got my award from Swedish King and Queen for outstanding contribution to health in Indo-Swedish partnership, I think it was in 2019, I thought this 25 years of work with Swedish government, with Finland and with Norway, while it continues still today with Sweden and Finland and many other countries across the world, actually gave me a sense of satisfaction that somebody recognized the contribution that we did jointly, and then kind of acceptance to us to receive that award. And you may have got many small little here and there awards, but to me that was the pinnacle, and I felt that was something, was a wonderful. I would say the journey is still on, but not end of the journey. But it was one of the important milestone in the journey of Mamta, which gave me a sense of satisfaction and emotionality also.
Dr. Mehra, as we are entering an era of change, I would say climate change globally, nationally, and so much happening in India, how are you seeing Mamta is placed, and what kind of work is it the institution looking to do in digital health, climate change, um, gender-based violence, all of these emerging areas?
Look, I've always been told that Mamta has always been 2 to 3 years or 5 years ahead of what it should be or other institutions might be. It's not an arrogance. I'm just saying that that is something which is being said. So in the same breath, I would say we have tried that we should be prepared for, say, 2030 and 2040. So one thing that we started doing, which was somewhere around 2014-15, was to create a research unit in the organization, right? We started publishing a lot of work. We were doing so much of interventions, but then what? It was just a report or for a donor. But then in early 2000, in the second decade of the 2000, we started working on evidence generation. And why I'm bringing it to this point to your question is that it's the evidence-based science that emerged more and more as we started publishing and we started learning the gaps in the evidence that exist in the issues that we address. So as we move further, we did not give up on the issues that we were working in last 2.5 decades, but we started looking at the niche areas within, say, sexual reproductive health, maternal health, child health, newborn health, adolescent health, which we should be investing in. At the same time, as India got more and more digitalized, technology-based solutions for improving health outcome became integral to it. We are there, but not there yet, right? We have to go. It's a journey which we need to carry on. And with the AI coming in, I think technology and digital technology is something which we are strengthening. We are focusing on last mile technology, right? That is where our intervention should be. In terms of climate, I think in 2020, it was around 2020 where we started giving concerted effort or working on climate and environment. So we have started working on that. But again, climate in context of its effect on maternal newborn, climate and its vulnerability index for the health outcomes. Again, working on improving primary health care for climate resilient societies and climate responsive healthcare systems, especially at the primary healthcare level. So I think the climate is becoming, you're absolutely right, is going to, it might undo many of the gains that we have had for last 3 decades. So working on climate, again with the maternal and child health lens, again with the less of gender, how climate would affect women more than what it would do to the other subsets of populations or to the underprivileged population or to the key populations that you would know. So we are expanding our work on climate change more and more. And I think we are there and we are ready to pick up anything as far as the climate change is concerned, building capacities and developing international partnerships like we have with World Bank, and we continue to strengthen our partnerships international level so that there's learning and doing both that's happening on the climate. And in terms of lastly, in terms of our management information system, that's becoming highly digitalized now. We get the data on same day, we enter it same day, and we are able to analyze it and work on it and try and see that our programming gets strengthened in a significant manner through a digitalized management information system.
And I think one thing which I really think is a shift that Mamta is doing is also making training platforms for healthcare workers, which is a part of digitalization. Um, Moving to my next question, I wanted to ask you that you have spoken about the vision and how Mamta is looking for, looking in future and what Mamta is going to do in future, what road it's going to take. What is your vision for future, 10 years from now, for the institution?
I think 10 years from now, I think Mamta should be doing all those things that I'm talking today because many of them have a lot of unfinished agenda. Mamta will continue to emphasize on community-centered approach, reaching people, reaching masses, reaching last mile will continue to be Mamta's focus, as we were rightly saying, but digitalizing our interventions, our healthcare interventions is going to be the critical side of the story. But improving quality of these interventions would be something that we need to continue to emphasize on, and we will continue to emphasize that. Working with governments or working with system has been there, and we will continue to strengthen that partnership with government so that we are able to deliver in line with national policies and national programs. Again, south to south collaborations is going to grow more. So I think Mamta should look in next 10 years for south to south collaboration, and north can be the facilitator of the collaboration, right? Mamta has a lot to share with the countries from its learning, as we have done in a bit in Nigeria case, we have done a bit in other one or two other African countries, but I think we could do that much more because we have a whole lot of 35 years of learning which we can share with people. Our academic work or our research needs to go to the next skill level. Its quality needs to improve to the next level. Last but not the least, improving competencies of institutional staff to address to the emerging needs, and technology is an ongoing process. It will have to continue to happen and continue to grow.
Yeah, that's wonderful, Dr. Mehra. My closing question for the section that we're talking about now is the road ahead. You spoke about staff, you have spoken in detail about partners and donors. What message would you like to give to the young professionals, to the new incoming talent in the institution, to the partners who's the partner base that is growing by the day for Mamta? What is the message that you want to give to them?
One, which I started with Priyanka earlier, let's be honest. Let's be uh, as value based as possible. The donor environment is shifting. You need to adapt to it. That's very critical because without resources, existence is difficult, but without compromising your value, vision, and mission. If that's sticking on, you will do a wonderful job as a young professional. But changing dynamics of the funding environment would entail that we are almost working in a corporate mode where you need to react and respond in a more corporate-ish manner. One thing I definitely want to say, which I've been saying to all young, even my children who are pretty young professionals, just follow good work, quality work, honest work. And my honest request to young people is do honest work, do quality work. You will definitely get your increments. You will definitely get better opportunities. You will definitely grow in your life. But if you adhere to that, this is a more, this is a robust foundation for your growth. Otherwise, if you're running after money, you may be right. I'm not saying to young professional, you're wrong. But my sense is that's my experience. That has helped me. That has helped my institution. And I feel it will help you. If you grow, Mamta grows. Mamta is nothing without the team of your professional it has.
It's really amazing to hear all, the reflections you have been sharing, Dr. Mehra. And as I said, it's so not so very easy actually to capture this incredible journey in one podcast. But still, if you have to describe Mamta's journey in one word or in a phrase, what you think it would be?
That's a tough one. Okay, one word or one phrase. Be passionate to the development world that you have come into. You can't be in development world without passion. Be honest, be value based, and at the same time, don't lose science and evidence because without science and evidence, your work will not have that kind of emphasis. I end with this.
Great. So if I summarize, it's like passion, work with your heart, but don't lose sight on science, right? So any personal reflections, Dr. Mehra, as you look back in this, 35 years of leading this wonderful, wonderful institution?
Before I reflect on this, let me emphasize that I cherish being a clinician, which I continue to be till date.
When I look at my pediatric colleagues, I start thinking on this question. Did I do right in coming into development world or public health as compared to being in a big hospital and a somewhat big super consultant? My reflection would be, I think I've done much, much, much to my heart's content having come to the development sector. If I had a next life, I would do the same mistake. I would definitely do this public health and development work. It's very satisfying. It's intervening with people, and when you see the faces changing from the time you enter and the time you come out of the community, I think you can't get a better gift or an award in your life than what you see the change in the community. But for that, you need to feel it, right? You need to feel, as you rightly said, heart. You need to have that heart to feel it. And once you have that heart to feel it, I think you will never repent coming to public health and development sector. And I really encourage many of my colleagues if they could do that.
Thank you so much, Dr. Mehra, for your time. As always, your words are always inspiring, not only for Mamta, but also many colleagues in this sector and in other sectors as well. Thank you so much for being with us for this podcast.
Thank you, dear. Thank you. So sweet of you. Thank you.